Assalamualaikum and good day. Welcome to part 1 of the lecture Chronic Inflammation and Granulomatous Diseases. My name is Dr. Mardiana Abdulaziz from the Department of Pathology, UITM. So at the end of part 1 of this lecture, you should be able to define chronic inflammation, briefly describe the causes of chronic inflammation, the differences between acute and chronic inflammation, and the morphology, both macroscopic and microscopic features of chronic inflammation. And skill-wise, you should be able to identify the macroscopic and microscopic features of chronic inflammation. So what is chronic inflammation? Chronic inflammation is an inflammatory response of prolonged duration. And we're talking about weeks to months to years, in which inflammation, tissue injury, and repair coexist at the same time. And because it happens in such a prolonged period of time, so you often get these overlapping features of inflammation, tissue injury, and repair. There are several causes of chronic inflammation. The first one is unresolved or recurrent acute inflammation. And then there is also persistent injury or infection. Or it could be due to a hypersensitivity or autoimmune diseases. And fourthly, it could be due to a prolonged exposure to potentially toxic agents, which may be endogenous or exogenous. Persistent infections or recurrent acute inflammation, there is some overlap between these two, so they're discussed together. Persistent infections are often the ones that cause chronic inflammation are persistent infections which are caused by microorganisms that are difficult to eradicate. So examples include mycobacteria for tuberculosis, for example, certain viruses, fungi, parasites. And in terms of persistent inflammation, if there is evolution of unresolved acute inflammation, for example, pneumonia, an acute pneumonia which progressed or evolved to form a lung abscess. Okay, so this is also an example of a persistent infection or persistent injury. Often this takes the form of a delayed type hypersensitivity reaction, and sometimes you can get a granulomatous reaction pattern. So examples of recurrent episodes of acute inflammation are as follows. This is a normal kidney, and this is a kidney involved by chronic inflammation. So sometimes this can be a result of reflux, where you get urine coming back up again. From distal back into the kidney, and this forms stasis and favors infection. So if this recurs and recurs and recurs, so these recurrent episodes of acute inflammation will progress to form chronic inflammation, and you can get damage to the tissue involved in that process. On the right side is an example of chronic cholecystitis, which is chronic inflammation of the gallbladder. Often this results from the presence of stones, as you can see here, in the lumen of the gallbladder. So the stones will irritate, it can block the flow of bile. So again, this because the stones are difficult to remove or eradicate, so they tend to persist in the gallbladder for a long time, and they cause these repeated episodes of acute inflammation and injury. So again, they progress to form chronic inflammation. In terms of hypersensitivity or autoimmune disease, again, this is also an important cause of chronic inflammation, and they result from excessive and inappropriate activation of the immune system. Example of autoimmune diseases are rheumatoid arthritis and multiple sclerosis. And allergic disease, example of that is bronchial asthma. So these inflammatory responses are inappropriate and they're harmful rather than protective. And because again they are so prolonged and the injury is persistent and continuous, so they can show a mixed acute and chronic features, and they tend to have fibrosis in the late stages. So this is an example of someone with rheumatoid arthritis where the hands and the fingers are all deformed as a result of fibrosis. Prolonged exposure to potentially toxic agents. So toxic agents can be exogenous, something coming from outside, such as silica, which can lead to pulmonary silicosis. You can also have endogenous toxic agents such as cholesterol, which results in atherosclerosis. So this is an example here. The lipid will deposit within the wall of the artery and cause local inflammation. So what are cells that are involved in chronic inflammation? Cells that are involved in chronic inflammation are different to the ones in acute inflammation. In acute inflammation, you see neutrophils. In chronic inflammation, you often see mononuclear cells. So macrophages, histiocytes, lymphocytes, which may be T lymphocytes or B lymphocytes, plasma cells, or you can see eosinophils and mast cells. The top three is probably the most important ones. Macrophages definitely play the main role in chronic inflammation, and they kind of have this bidirectional interaction with the lymphocytes as well. So what are macrophages? Macrophages are derived from hematopoietic stem cells in the bone marrow and also embryonic yolk sac and fetal liver during early development. So in the bone marrow, they produce the hematopoietic stem cell. They circulate as blood monocytes and they will be activated in inflammation. So they will migrate and go to the site of injury in the same manner as we had discussed in the lecture acute inflammation. So they follow the same sequence of transmigration, chemotaxis, activation, etc. Also, they can reside, so the macrophages can also reside in various tissues and organs. These are called resident tissue macrophages, such as Kupffer cells in the liver, alveolar macrophages in the lungs. Okay, so they sort of police and patrol these areas like all the time. They're there all the time and they're activated upon injury or stimulus. So macrophages have several functions. They display antigens to T cells and they respond to signals by T cells. They ingest, so they are phagocytes. They ingest and eliminate microbes and dead tissues. They secrete mediators of inflammation, but they also have function in repair. So they initiate tissue repair as well. Macrophages and lymphocytes, they're kind of best friends. So they have this bidirectional interaction which helps in the process of inflammation. This diagram illustrates the macrophage and lymphocyte interaction in chronic inflammation. So macrophage can secrete cytokines and also they present antigen to T cells, and the T cells are activated. The activated T cells produce cytokines which then activate macrophages. So they have this sort of bidirectional interaction and they help each other with the outcome of activating more leukocytes, calling up more leukocytes to the site of injury, both by lymphocytes and by macrophages. So we talked about how leukocytes need to be activated first before they perform their function. There are two main pathways of macrophage activation. So they can undergo the classical pathway of activation on the left side, or they can go through the alternative pathway of activation. Activation through the classical pathway will result in the macrophages having a pro-inflammatory function, as you can see here, microbicidal actions, phagocytosis, inflammation. Activation through the alternative pathway will lead to the macrophages acquiring and performing function which have anti-inflammatory effects as well as tissue repair and fibrosis. So the function of macrophages, again, quite diverse. The morphology of chronic inflammation illustrates the definition of chronic inflammation itself. The typical morphology of chronic inflammation will show infiltration by mononuclear cells. So these are the cells of chronic inflammation we mentioned earlier, as well as presence of tissue destruction and attempts at healing. So attempts at healing in this setting means the presence of angiogenesis, so formation of new vessels, as well as fibrosis. So this is an example of chronic inflammation in the lung. Okay, you can see the presence of mononuclear cells here. These are small kind of blue dots. These are all nuclei of the inflammatory cells. There is presence of fibrosis, which is evidence of tissue repair or healing, and also there is evidence of tissue destruction, because these should all be alveolar spaces with kind of not much of interstitial tissue in between, but here you can see a lot of fibers going on in between these alveolar spaces. So this is fibrosis and tissue destruction. So here I just want to highlight a few differences between acute and chronic inflammation in this table here. So they differ in terms of onset, one being immediate and rapid, while the other being delayed and insidious. They differ in duration, one is shorter and the other is much longer, can go up to years. Cardinal signs, as we mentioned, they're present and quite prominent in acute inflammation, but they are not so in chronic inflammation. The vascular changes are in the form of vasodilation and increased permeability in acute inflammation, but it is more prominent in terms of new vessel formation in chronic inflammation. The causative agents can differ while there is some overlap. The major cells are also different. Neutrophils predominate in acute inflammation, while mononuclear cells predominate in chronic inflammation. Both types of inflammation have associated mediators. The outcomes can be different. Systemic manifestations can be seen in both, with some differences between them. Now let me share with you some images to illustrate some morphological changes that can be seen in the setting of various causes of chronic inflammation. So this is an example of chronic pyelonephritis, same as I showed you earlier, normal kidney and inflamed kidney, which is distorted and fibrotic. This is an example of cholecystitis, inflammation of the gallbladder. So this is normal gallbladder, which has very thin wall, velvety mucosa, glistening serosa on the outer surface. But in the setting of chronic inflammation, because you have fibrosis, then you can see that the wall is now markedly thickened and rigid. Moving on, so these are joints in rheumatoid arthritis. So again, in autoimmune disease, because you have your immune system basically produces antibody against your own tissue. So your tissue will be damaged and you get fibrosis and inflammation and subsequent distortion as well. And this is atherosclerosis. Cholesterol, lipids, they form endogenous toxic agents which deposit and induce inflammation, and inflammatory cells, including macrophages, will form and aggregate within the wall of the vessel. So that wraps up part 1 of the lecture, Chronic Inflammation and Granulomatous Diseases. And for this part 1, we had focused on chronic inflammation, in which we have covered the definition of chronic inflammation. We have discussed the causes and pathogenesis of chronic inflammation, in which there is persistent injury or persistent infection, there is recurrent acute inflammation, there is also immune hypersensitivity reaction, as well as exposure, a prolonged exposure to toxic agents. We have discussed the cells of chronic inflammation, including macrophages, and also we've discussed the role of macrophages in chronic inflammation. We've talked about the morphology of chronic inflammation, in which grossly it is typically due to distortion, in which grossly there is often distortion and tissue injury as a result of fibrosis, and microscopically, in which you can see tissue injury, inflammation, and repair going on at the same time. We've also discussed, as illustrated by a table, the differences between acute and chronic inflammation. I'll see you again in part 2 to discuss on granulomatous diseases. Thank you.